Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are on retinal diseases, do's and don'ts. Doctor, my first question for you is, what are the common symptoms of retinal diseases and when should I seek medical attention?
Well, India is supposed to be the diabetic capital of the whole world. So we are sitting on a volcano and we say that in next 20 years, whatever number of ophthalmologists we produce, it will not be able to suffice to take care of the diabetic damage that it's going to cause to the eyes. So one has to be very, very careful about diabetes causing eye retinopathy or damage to the eye. So the damage to the eye due to diabetes is called diabetic retinopathy. That's the most common. There are so many other things which in a short time I will not be able to discuss with you. But most common is diabetic retinopathy. So let's discuss about that. If you are a diabetic, the day you are detected a diabetic, get your eye checked up for retina. So a retina evaluation on the day of detection. Then you can get it checked once every year till 10 to 15 years. Because if you do not have diabetic changes in the retina, for 10 to 15 years you are safe, provided you are maintaining your blood sugars and cholesterol and lipid profile. After that, after about 15 years, you have about 15 to 20% chance of developing diabetic retinopathy, and you need to then follow up more often. Okay, the retinopathy can have stages. So we have what is called as mild, moderate, and severe non-proliferative diabetic retinopathy, where there is leakage and some bleeding. And in second thing, we call it as proliferative diabetic retinopathy. There is frank bleeding. So if your eye goes into proliferative diabetic retinopathy, it is a bad state. You are very, very likely to almost lose vision or maybe maintain some amount of vision if treated adequately. But if you are in the non-proliferative diabetic retinopathy stage, your eyesight can be preserved to a great extent. The second most common cause of retinal disease is called ARMD, age-related macular degeneration. This occurs in relatively older age group beyond the age of 60. Again, many people do not complain of anything except some complaining that the straight lines appear wavy. Okay, or there may be small black areas which are not through which you cannot see. So these are small complaints that they have, or else actually it is to be diagnosed by the ophthalmologist. If the ARMD progresses from dry ARMD to wet ARMD, then the vision gets affected. And in wet ARMD, there can be bleeding, and the bleeding can be massive. Very large blood clot occurs below the retina, and these cases respond very poorly to medicine. So this is ARMD. How do you prevent ARMD? Well, these are aging changes. So you take some antioxidants, do regular exercises, have a healthy diet. So whatever things we do to decrease our aging process, the same thing. The third common cause is blockage of the vessels. In medical term, we call it as vein occlusion. So retinal venous occlusion, it is due to clot formation. Anywhere in the body, the clot can migrate into the retinal vessels and it can block. So that leads to the lack of blood supply to the eye, leading to decreased vision. Again, it has some treatment which can be usually which can be done with injections or lasers. So, but most important is you have to maintain your parameters like diabetes, blood pressure, and cholesterol. These are the three most important findings which can precipitate blockage. You can also monitor your blood levels of certain chemicals, which can also cause increased chance of developing BRVO. The last one, which we commonly see here, is called CSR, central serous chorioretinopathy, which is swelling in the retina due to leakage from any of the blood vessels, which may not be due to diabetes or high blood pressure, but it can be spontaneous. Commonly observed in people who are very, very anxious and too much stressed out. So in these patients, you have a central dark area through which your vision becomes hazy, and gradually in 6 to 8 weeks it improves.
What kind of lifestyle changes or habits should I adopt to protect my retinal health and prevent diseases?
Yeah, so as we already discussed, that your body need to remain healthy. So you need to have regular exercises, you need to have proper diet, sleep well. The stress and anxiety is another factor you have to avoid. If you have any cardiac disease, consult your doctor and get that under control. Your systemic conditions have to be monitored well, so your retina will remain healthy.
Are there any specific activities or environmental factors that I should avoid to reduce the risk of retinal diseases?
Well, it was believed that the UV exposure was one factor, but nowadays, see, most of us, except those who are working in the fields, do not have too much of UV exposure, but still, that is one factor which can cause ARMD, age-related macular degeneration. So as an environmental factor, you can start wearing a sunglass to protect your eyes from the UV radiation.
So doctor, your expertise and insights on retinal diseases, do's and don'ts are invaluable to this initiative. And we believe your participation will greatly benefit the patients.